Dementia is one of the most feared brain diseases on the planet, yet most people are dangerously misinformed. What you think you know about dementia could actually increase your risk. Families miss the early warning signs. Doctors delay treatment, and millions suffer simply because they believed a lie. Maybe you've heard that dementia is just memory loss, or that it's a normal part of aging, or worse, there's nothing you can do to stop it. But new research proves these beliefs are not only wrong, they're harmful. In this video, we're exposing 10 of the most dangerous dementia myths, starting with one almost everyone still believes. Let's begin. Myth number 1. Dementia and Alzheimer's are the same thing. Many people use the terms dementia and Alzheimer's as if they mean the same thing, but they aren't identical. Think of dementia as an umbrella term for a group of conditions that cause memory loss, confusion, and trouble thinking or making decisions. Alzheimer's disease is just one type of dementia, but it's the most common, making up about 60 to 80% of cases. Other types of dementia include vascular dementia, caused by poor blood flow to the brain, often after a stroke. Lewy body dementia can cause hallucinations, movement problems, and severe confusion. Frontotemporal dementia affects personality and behavior before memory loss appears. Each type of dementia progresses differently and has different symptoms. That's why getting the right diagnosis is so important. It helps doctors find the best treatment and support for each person's specific condition. Myth number 2. Dementia is just a normal part of aging. It's common to hear people say, "Oh, they're just getting old," when someone starts forgetting things. But while mild forgetfulness can be a normal part of aging, dementia is not. As people age, they may occasionally forget names or misplace items but still remember them later. Dementia, on the other hand, causes progressive and severe memory loss, confusion, and personality changes that interfere with daily life. Many people live well into their 80s, 90s, and even 100s with sharp minds. Dementia is caused by damage to brain cells, not just aging. Healthy lifestyle habits, cognitive stimulation, and managing health conditions like heart disease and diabetes can help prevent or delay dementia. Aging is inevitable, but dementia is not. Keeping your brain active and your body healthy can make all the difference. Myth number 3. Dementia is always inherited. Many people worry that if a parent or grandparent had dementia, they are guaranteed to develop it too. While family history can increase your risk, most cases of dementia are not directly passed down. In rare cases, dementia runs in families due to unusual gene changes, especially in people who develop it before age 65. However, for the vast majority, dementia is influenced by a combination of lifestyle, overall health, and aging, not just genetics. Some people inherit traits that increase their risk, but this doesn't mean they will definitely get dementia. In fact, many people with a family history never develop it, while others with no family history do. Your daily habits, what you eat, how active you are, how well you manage stress, and how you take care of your heart and brain play a much bigger role than your genes. Having dementia in your family means you should be mindful and take preventive steps, but it does not mean your future is set in stone. Your brain health is still in your hands. Here's the truth. What you do today shapes your brain's future. Up to 40% of dementia cases are preventable, yet most people wait until it's too late. The brain starts declining years before symptoms appear, meaning every decision you make right now matters. The good news is that you still have time to fight back. The right choices, what you eat, how you move, and how you challenge your brain can make all the difference. Dementia isn't just about aging, it's about how you protect your brain starting today. Let's keep going. Myth number 4. Dementia patients can't enjoy life. Many assume that once someone is diagnosed with dementia, their life is over, that they can no longer have meaningful experiences or enjoy their favorite activities. But that's far from the truth. In the early and even mid stages of dementia, many people continue to enjoy hobbies, form new memories, and spend quality time with loved ones. Engaging in activities like gardening, music, painting, light exercise, or simply socializing can provide joy and mental stimulation. Even in the later stages, while verbal communication may decline, emotions and sensory experiences remain intact. Many dementia patients respond positively to familiar voices, music, gentle touch, and being surrounded by loved ones. This is why music therapy, pet therapy, and sensory activities are often used to improve mood and reduce anxiety in dementia patients. The key is to adapt activities to their abilities. Instead of expecting them to do things the way they once did, adjusting tasks to their current level can help them feel engaged and valued. A dementia diagnosis does not mean life is over. It just means finding new ways to experience joy. Myth number 5. Dementia is a mental illness. Dementia is often mistaken for a mental illness like depression, bipolar disorder, or schizophrenia. While some symptoms overlap, dementia is actually a neurological condition, not a psychiatric disorder. Mental illnesses are typically caused by chemical imbalances in the brain and can often be treated with medication and therapy. Dementia, on the other hand, is caused by physical brain damage, resulting in progressive brain cell loss. This permanent structural damage is what causes memory loss, confusion, and cognitive decline. That said, dementia can lead to mental health challenges such as depression, anxiety, paranoia, and even hallucinations, especially in diseases like Lewy body dementia. This is why dementia care often involves both neurological and psychological support. Recognizing that dementia is a disease of the brain, not just a mental disorder, is important for reducing stigma and ensuring proper care. Many people with dementia still experience emotional responses, moments of clarity, and the need for human connection, just like anyone else. Myth number 6. Aluminum causes dementia. For decades, people have feared that aluminum cookware, cans, or antiperspirants could lead to dementia. This belief started in the 1960s, when high aluminum levels were found in the brains of some Alzheimer's patients. But research since then has found no solid evidence that everyday aluminum exposure causes dementia. Yes, aluminum can accumulate in the brain, but so can many other substances. The real issue isn't aluminum itself, but how the brain processes and clears toxins as it ages. Major health organizations like the Alzheimer's Association have stated that aluminum is not a proven risk factor. Dementia is primarily caused by genetic, vascular, and inflammatory factors, not by using aluminum cookware. Avoiding highly processed foods, managing blood pressure, and staying mentally active are far more important for protecting brain health. There's no need to throw away your aluminum pots and pans. Focus on real risk factors, not outdated myths. Myth number 7. Only elderly people get dementia. Most people associate dementia with old age, but you don't have to be elderly to develop it. While dementia is more common in people over 65, it can also affect younger adults, even those in their 40s or 50s. This is called young onset dementia, and it can be especially challenging because symptoms are often misdiagnosed as stress, depression, or even menopause. Younger people with dementia may struggle with forgetting appointments, losing track of conversations, or making poor decisions at work. Things that seem minor at first, but gradually worsen. Since most people don't expect dementia at a younger age, they often go years without a proper diagnosis. Regardless of age, Dementia is caused by damage to brain cells, not just getting older. It's important to pay attention to early symptoms, no matter how young or old you are. Myth number 8. Dementia patients don't know what's happening. A heartbreaking myth is that once someone has dementia, they're completely unaware of what's happening to them. While dementia does affect memory and cognitive function, many people in the early and even mid stages are fully aware of their struggles. Imagine knowing you're forgetting things, but being unable to stop it. This can cause frustration, anxiety, depression, and even embarrassment for dementia patients. Many people become withdrawn, avoiding conversations or social events to hide their struggles. Even in later stages, when verbal communication declines, people with dementia still experience emotions and recognize familiar voices, music, and touch. That's why music therapy, reminiscence therapy, and emotional connection are so important for improving quality of life. Dementia may steal memories, but it doesn't erase a person's need for love, dignity, and human connection. Understanding this can help caregivers provide compassionate, patient-centered care that makes a real difference. Myth number 9. Dementia only affects memory. Many people think dementia is just about forgetting things like names, faces, or past events, but it affects much more than memory. It can change a person's ability to think, speak, move, and even control emotions. For example, dementia often causes mood swings, aggression, or personality changes before memory loss even begins. A person who was once patient and calm may become easily irritated, anxious, or withdrawn. Others may struggle with problem solving, get lost in familiar places, or have trouble following a conversation. Dementia can also impact physical abilities. Some people develop poor coordination, trouble swallowing, or difficulty walking, increasing their risk of falls. Conditions like Lewy body dementia can even cause hallucinations or tremors, making it easy to mistake for Parkinson's disease. Dementia is not just about forgetting things. It's a progressive disease that can affect the entire body and mind. Recognizing these less obvious symptoms is crucial for early diagnosis and better care. Myth number 10. Once you have dementia, there's no hope. A dementia diagnosis can feel terrifying, but it doesn't mean life is over. While dementia can't be reversed, research shows that certain lifestyle changes can slow its progression, especially if detected early. Regular exercise, a healthy diet, staying mentally active, and socializing can help maintain brain function for longer. Medications can also help manage symptoms and improve quality of life. Some people live for years or even decades with mild symptoms before needing full-time care. There are also breakthroughs happening in dementia research, with new treatments being tested to slow or delay its effects. The key is early intervention. The sooner someone gets help, the more they can do to stay independent for as long as possible. Dementia is a challenge, but there is still life to be lived. With the right support, people with dementia can find joy, purpose, and connection for years to come. Dementia isn't just about aging, it's about awareness and action. If you've made it this far, you're already ahead of most people, but don't stop here. Watch our next video to learn the early signs everyone misses, because the earlier you act, the more you can protect your future.